This video will discuss the prevalence and burden of chronic pelvic pain in women and people assigned female at birth.
My name is Rachel Langer. I was 14 years old when I first started experiencing pelvic pain. It started shortly after my first period, and it started mostly as period cramps, but then it started coming more and more often. It was a radiating, pulsing, and sometimes stabbing pain that would render me unable to do the things I wanted to do. It came with nausea. I would feel sick to my stomach. Sometimes I would think I was gonna throw up.
My name is Anita David, and when I started first experiencing pelvic pain, I was about 12 years old.
Chronic pelvic pain is persistent pain below the belly button and between the hips lasting more than 3 months. This pain may be intermittent or continuous, cyclical or non-cyclical.
Chronic pelvic pain is not normal. It is common, and not describing it as common to patients is part of what adds to diagnostic delays, and also what makes people feel like they can't talk about it or share their stories with one another.
Chronic pelvic pain is associated with symptoms such as fatigue, back pain, dysmenorrhea, dyspareunia, and dysfunction of the lower urinary tract, bowel, and myofascial systems.
When I think about how my pain feels, it feels like sharp stabbing pain deep inside of me. It feels like someone has taken a knife and is twisting it around and scraping out my insides at the same time.
Chronic pelvic pain affects approximately 15% of women and an unknown number of gender-diverse people, which adds up to over 2 million people in Canada.
My pelvic pain is more widespread than I expected. It radiates around to my back. I feel it in my hips. I have GI interactions. I have a harder time sometimes emptying my bladder, and I have complications with my digestive system. It changes in form. Sometimes it's sharp and stabbing, sometimes it's radiating, sometimes it's a dull ache. And I'm not sure what the difference between these things are or what they mean, but I experienced the gamut, and it even kind of can flare down your legs and up into your back or your, abdominal cavity as well.
Through all my painful episodes, whether I was lying crouched in my bed or on the floor or in my bathtub with all the baking soda, I remember even just weeping because I didn't know what to do. I didn't know how to deal with it any more than I already had been for most of my life. And it never occurred to me to go to the ER because I thought people go to the ER when they have an emergency, and it never crossed my mind that I was having an emergency.
It can significantly impact cognitive, behavioral, and emotional functioning. Chronic pelvic pain is not normal. It causes severe distress and creates a substantial burden for those it affects. For example, the impacts may include difficulty with daily activities, loss of work or educational productivity, and an overall reduction in quality of life. Other related symptoms can add to this burden, such as the effect of sexual pain on relationships.
So the burden of pelvic pain on my daily life means that most of the time I wake up in pain. Most of the time I have to go on Zoom to do my work or be in public and put on a happy face and do what I need to do. It means that when I come home, I crumple on the floor. It means I neglect my housework. It means I don't get to the bank to put money in there. It means that maybe I don't have enough groceries in the house. It means that it's very hard to keep life flowing.
My pelvic pain has affected my family planning because I do have a condition that caused me to, need surgery. I've had 4 surgeries now, and one of them was to remove my uterus. So I was not able to have children, and it changed the way I thought about my future as a potential, mother. And yeah, it's basically altered that whole trajectory for me.
I was about 30 when they actually told me, they actually gave a name to my illness. During that time, I realized that I probably wouldn't have kids, even if I wanted kids. At that point, I was a little bit undecided. And then when I found out that I would likely need a lot of IVF treatments or anything like that to have kids, it hit me in a strange way, because it's one thing to make a choice that if you don't want kids or if you do want kids, but it's another thing to not have that choice anymore, or realize that I could put a lot of money into IVF treatments and not have the result I want. As I look for a partner in my life, it's a hard conversation to say, I can't have kids. And it did cost me some relationships.
Pelvic pain has had a financial impact on me, mostly because I live in fear of not being able to work. And so I'm constantly collecting work whenever I can. I'm a freelancer. I can't be sure when my next paycheck is coming, or that when it does, I'll be able to show up and be my best. I probably grit through that more than I should, but you just never know what the future's gonna look like. So I'm more the person who you'll find laying on the floor of her office, in pain with her laptop. But it still has a consequence, because when people see that, their response to that is, oh, maybe you should be at home, maybe you shouldn't be here, maybe we shouldn't hire you next time. And you're constantly worried about how showing your pain is going to affect your financial stability. It is expensive. I have good insurance, extended medical, but even then I'm spending, hundreds of dollars a year on prescriptions, but additional therapies aren't covered. Physiotherapy maybe, acupuncture mostly not, so any kind of additional holistic look that you want to take at your healthcare, you're out of pocket for, and you really have to always be running a cost gain analysis on, is this going to make me feel better enough to justify the cost that I'm going to spend?
I lived a little far from the university, and so even getting on the bus and traveling there and then walking to the school and being there all day and not being close to home was really hard. So I missed a lot of classes, and I would ask people for notes, and some people were really nice about it, but I had the sense that people thought I was just lazy and not showing up and then freeloading off of their notes, which wasn't the case. But again, I didn't have the words to say, I'm hurting, I'm suffering, I'm living with this disease, and I'm trying to cope.
Chronic pelvic pain may appear as a condition on its own, or as a symptom of another condition. Many people experience multiple contributing factors to their chronic pelvic pain. Possible contributors may include gynecologic causes like endometriosis, urologic conditions such as painful bladder syndrome or interstitial cystitis, gastrointestinal issues such as irritable bowel syndrome, or musculoskeletal and myofascial disorders, like pelvic floor myofascial dysfunction, and many others. Myofascial abdominal pain, pelvic girdle pain, low back pain, referred hip pain, joint hypermobility, and postural imbalances can further contribute to chronic pelvic pain. Chronic pelvic pain often overlaps with other conditions that also involve nociplastic pain and central sensitization. These include fibromyalgia, chronic migraines, painful bladder syndrome, poor sleep, low mood, and fatigue. It's important to consider these co-occurring conditions in both diagnosis and treatment.
Joint hypermobility was something I didn't expect to be part of my pain journey, but it presented itself a bit later along the line for me. And for me, it means I'm hyper flexible, I can bend very easily, and my joints are constantly in pain or feel like they're sliding off. I experience dislocations frequently. This is something that I realized only recently is very common amongst people with chronic pelvic pain or a pain journey similar to mine. I don't think it's been very researched or studied, but it is definitely a commonality that I'm finding with a lot of other people that I speak to about chronic pelvic pain.
Various types of pain can contribute to chronic pelvic pain. Nociceptive pain is pain that arises from actual or threatened damage to non-neural tissue and is due to the activation of nociceptors. For example, pain from endometriosis lesions that causes localized pain. Neuropathic pain is pain caused by a lesion or disease of the somatosensory nervous system. Nociplastic pain, also known as central sensitization, is pain that arises from altered nociception, despite no clear evidence of actual or threatened tissue damage causing the activation of peripheral nociceptors, or evidence for disease or lesion of the somatosensory system causing the pain. Nociplastic pain may be linked to central sensitization and can contribute to the development and persistence of chronic pelvic pain. Central sensitization lowers the threshold for what causes pain. As a result, people may experience ongoing pain even after the original injury has healed or treatment has begun. For instance, people with endometriosis may continue to have pain even after surgical removal of lesions. This is a critical consideration when planning treatment options for chronic pelvic pain.
I didn't know what central sensitization was until after my second or third surgery, and I learned that some of the things that I had been experiencing, like back pain or widespread pain, joint pain, fatigue, even some of my nausea or tension pain, headaches, could be connected to central sensitization. And I didn't realize that pain is sort of a trigger, that it's in and of itself, that pain causes more pain. And it took me a long time to understand that central sensitization didn't mean that it was all in my head, and it didn't mean that I was the problem. It meant that my body was having a physiological response to the pain that I was already in. So I've experienced much more of that than I expected once I learned what it was.
Living with chronic pain can take a serious toll on psychological health. However, chronic pelvic pain is not in the patient's head. Pain catastrophizing, fear avoidance, depression, anxiety, insomnia, and active trauma symptoms may all be associated with chronic pelvic pain and may intensify or prolong the experience of pain.
I've had GPs though, or I've talked to doctors that have said, "You're too much for me. There's too much going on with you. You're too complicated." And that makes me feel awful. That makes me feel like no one is there to help me, or no one wants to help me. And yeah, I became depressed. I became anxious because I just felt more and more isolated in the world.
The mental health toll for me of chronic pelvic pain has been sneaky because I'm a doer. I like to get out there and live my life, and feeling like it's blocking me from my ambition or the things that I enjoy in life and want to be doing is a real challenge. It starts to make me feel that I'm failing, even though I know it's not my fault. And I start thinking about the wider question of living with it for the rest of my life and what that looks like. And it feels so daunting sometimes that it makes me situationally depressed about what my future looks like. And if I'm not taking it one day at a time or bite by bite, then sometimes I find it overwhelming.
Despite the overwhelming impact that chronic pelvic pain has on people's lives and how common it is, many individuals reported that their pain was initially dismissed by a healthcare provider.
The why was something that always really mattered to me, but when I would bring that up, that was immediately dismissed. And I think that's systemic. We have a very full system. We have since I was 14.
That dismissiveness really does take a toll, like when someone doesn't believe what you're going through. Chronic pelvic pain is debilitating. It affects every area of my life. It affects every area of any woman that suffers from it. Explaining the why and the how, and help us find solutions.
Watch the next video in our series to learn more about the appropriate diagnostic strategies for chronic pelvic pain.